You're listening to the Dental Student Vibes podcast, where it's all about good vibes. This is Dental Dimes, a 10-minute episode of some hot topics in dentistry, or whatever we feel like talking about. I'm your host, Seth Kalish, and I'm here today with Qasim Naqvi and Anthony Wallish. So we're going to be talking about the transition of the dental profession, what's going on in the industry. So we've got a study here from the Levin Group. It's called the Annual Practice Survey. It's in one of the recent issues of Dental Economics, and we thought there were some pretty interesting statistics, for everybody to ponder over. So first of all, we all know how dentistry is changing.
Yeah.
The rise of the DSOs, right? So an important fact is 1 out of 5 dentists now work for DSO.
That's such a high percentage compared to 20 years ago.
Yeah, that was a higher percentage than I expected. So I was a bit surprised when I read something like that.
1 out of 5. And I feel like it seems like most of us in school are kind of like our future plan seems to, at some point, we're going to end up working for a DSO.
Yeah, I think it's definitely gotten a lot more common. And obviously, looking at the facts, 20% is a lot higher than I expected. So I think they offer a lot of good opportunities. And there's a lot of perks, like the CE courses that some of them pay for.
It's huge.
There's so many different things. That's the first thing that comes to my mind.
The C's, that's nice.
It'll probably be up on the rise too if we look at this, 5-10 years from now, too, down the road.
Right, yeah, definitely. And I think a big factor that is causing that is private equity penetrating into the sector, that's how ophthalmology went, medicine went, or optometry, pharmacy.
Yeah.
So, is that a good thing or a bad thing? Like, maybe it'll be good for the competition, but maybe not so good for the dentist. Who knows, right?
Yeah.
Who knows? However, I think everybody, like Howard Ferran of Dentistry Uncensored likes to say, DSOs have their place. So, anyways, next up, we have retirement. So, first of all, before you look at this statistic, when do you see yourself retiring? What age?
Me personally, it's probably going to be younger than what most people would say, but I don't want to be that guy who's 80 years old getting kicked out by a young gun.
Yeah.
But I would say most people probably around like 70, 75 maybe.
70? Wow.
Yeah, I think this is a great profession if you can stay healthy and keep your body healthy. We learned a lot about musculoskeletal injuries and ergonomics and stuff, but if you can keep your body healthy and you can keep your production rate up, I think people can do this profession for a long time to come.
Okay, well, I'm very surprised that you said that because according to the survey, it says the most anticipated retirement age is 70.
Oh, there you go.
And that's surprising that you kind of hit that on the head.
Thank you.
But is that a good thing? I don't know. Probably not, right? We want to retire earlier than later.
I personally probably plan to retire before 70, but maybe 50 years down the road.
Right.
Who knows?
Yeah, that's the thing. I think obviously, like Anthony said, and that was a really good point, is if you can stay healthy and you're enjoying it, then why not stay as long as you can,
Yeah.
I think it's kind of similar to how athletes are nowadays. And then especially with the progression in technology in medicine,
right?
I think there's going to be a lot of things. I'm not saying I'm going to have like a robotic back or anything by the time I'm 60 or
I would get a robotic back.
But, obviously the increase in healthcare and the way they're progressing with being able to help you with those things helps.
But I don't know if that's necessarily the reason why. I think it's because of the shift. And so let's get into this. So let me throw one other stat in there. Only 4% of dentists expect to retire before 55. So that's pretty low. So what we're going to get into is why does this happen? So what this survey is trying to convey to us is basically the students are taking on more student loan debt, right?
Yeah.
And basically they're looking at purchasing a practice later in their timeline. So therefore, what happens to the selling dentist, the senior dentist? He can't sell his practice. So therefore, he's going to own the practice for later and later and later. And that's kind of maybe you could call it a cultural shift sort of thing.
Yeah.
Or not a culture shift, but like a shift in the industry, right?
Yeah.
So that's kind of a point that the survey was trying to make.
Yeah, I think, and we had an episode on equity last week that we released, and I think it's kind of good that we know these statistics ahead of time, especially when it comes to acquiring your own practice or being able to manage your student debt. Finding creative ways on being able to get that down and reduce it as much as you can to where you can acquire a practice is probably one of the most important things we could do right now, because I don't ever want to be in a position to where by the time I'm out of school, I'm not really familiar on how I can manage my student loans as well as acquire a private practice as well, because that's what I'd like to do ultimately.
Right. Well, I'll tell you one thing, because we're vibing right now and we're getting this information down, we're going to be coming out of school and we're going to be crushing it.
Absolutely.
A couple other things here. Average overhead is now at 66%. So that's starting to go up. And what we would like to see, according to Mark Costas, you want to get at a nice 55% level, right? So that's on average. So, through this podcast, we're going to learn, along with all of our listeners, how to get that overhead down in lots of different ways. That's coming up in the future, okay? A couple other things. The number of dentists who refer their patients to specialists has started dropping. So basically, dentists are referring out less, and they start taking on more of these specialized procedures.
Yeah, we know like Dr. Menendez hasn't referred out in, I think it was like 20 years, he said, or something like that. And it's just all about becoming competent in your own practice and learning how to expand your knowledge.
Yeah.
And I think that's where dentistry is going, whereas general dentistry is going to go back to general dentistry. You're not just doing, operative stuff. You're going to start doing more complicated and surgical things.
Right. But also Dr. Menendez, he's a master of AGD.
Yeah, he's a perfect
he's the man.
example.
He is the man.
Not everyone's going to be up to his level of expertise at any point in their life. That man can do some crazy stuff.
Yeah, he can. Absolutely.
Yeah, I think that's why sometimes you have to really analyze the statistics, but I agree with your reasoning as well. Of course, you see a lot of advertisements for CE courses, we're talking about endo, ortho. I'm not sure with perio. I'm not super familiar with it, but I would imagine there's quite a lot of perio courses you can take. Oral surgery perhaps as well. So there's definitely a trending shift.
Right. One last thing here. The amount of ortho that general dentists are providing now is increasing a lot. It's going up, and now according to the survey, it says that 52% of general dentists offer orthodontic treatment, and out of that 52%, 90% of them offer clear aligners, like Invisalign, stuff like that. So that's crazy. Obviously, that trend going upwards, and I know a lot of young dentists want to get into that, take those CEs right when they get out of school.
Absolutely. I think it's a smart idea, and I think orthodontics is a great topic to get into if you can learn how to bend the wire and do all that kind of stuff that great orthodontists can do. So if you can jump on that train and become someone who does braces as a general dentist, by all means do it.
Yeah. Here's the thing though. You're held to the same standard of care as the orthodontists provide. And I know Dr. Mann, who's an orthodontist in St. Pete, he says that he gets a lot of cases where sometimes general dentists, they don't necessarily give that super high standard of care. And I know Dr. Mann is an excellent orthodontist, so he has to kind of pick up the slack in some of those places. So if you want to do stuff like that, you got to get really good at it. You know what I'm saying?
Mm-hmm. It's your name on it.
So yeah, absolutely. And like you were saying, if you're trying to perfect your craft, you have to make sure that you put in the work for it, because even if you're taking a CE course, it doesn't necessarily mean that you might be completely ready by the time you're done with the course. So you always have to keep those things in mind and make sure that you're fully comfortable, I would imagine. You got it. All right, fellas. Thanks for chit-chatting with me about these upcoming trends in dentistry. I want to thank our audience for listening. Please follow us on Instagram at dental.student.vibes, on Twitter and on Facebook. Until next time.